Seniors, stop these 5 checkups after 60. They might harm you more than help senior health tips every year. Millions of seniors walk into clinics with one goal: to stay healthy. But what if I told you that some of the most common medical tests recommended after 60 could actually do more harm than good? That instead of protecting you, they might trigger unnecessary surgeries, dangerous medications, or even irreversible complications. Today, we're exposing 5 health checkups that seem helpful on the surface, but could quietly chip away at your well-being, your independence, and in some cases, your life. These are tests many doctors still recommend out of habit, not evidence. But new studies, stories from real seniors, and decades of data tell a different truth. So if you're over 60 or love someone who is, this might be one of the most important videos you watch all year. Because what you're about to learn could save your health, your money, and your peace of mind. Let's start with the 5th checkup on our list, the one that almost always ends with a prescription, and rarely with a benefit. Checkup number 5. Bone Density Scan DEXA. At first glance, it seems harmless. A quick scan, no needles, no pain, and you walk out with a number that tells you how strong your bones are. Sounds responsible, right? But after 60, especially if you've never broken a bone or fallen, that number might do more harm than good. The DEXA scan is designed to detect osteoporosis by measuring bone density. But here's the hidden truth. Aging naturally reduces bone density. It's as normal as wrinkles or gray hair. And in most seniors, a DEXA scan will show some form of low bone mass, even when there's no real fracture risk. This leads to panic-hand prescriptions. Drugs like bisphosphonates, alendronate, risedronate are often pushed immediately. These medications aim to strengthen bones, but come with serious side effects: esophageal damage, bone pain, and in rare cases, jawbone death. A 2021 study in the Journal of the American Geriatrics Society followed over 1,200 women over age 70. It found that bisphosphonates reduced fracture risk by just 0.3% after 5 years. That's a microscopic benefit compared to the digestive issues, inflammation, and loss of mobility many patients experienced. Take Judith, 68, from Ohio. She was active, walked daily, and had no history of fractures. But after a scan showed osteopenia, not even full osteoporosis, she was put on medication. Within months, she developed severe acid reflux and stopped exercising. Her quality of life dropped more than her bone density ever did. The better path for most seniors. Focus on lifestyle, weight-bearing exercise like resistance training, vitamin D, calcium-rich foods like leafy greens and sardines, and fall prevention. These strategies, according to a 2022 Osteoporosis International study, reduce fractures by more than 20% without a single pill. Checkup number 4. Brain MRI for mild memory loss. Forgetfulness happens. Misplacing keys, struggling with a name. Walking into a room and forgetting why that's aging, not necessarily Alzheimer's. But in today's world of high-tech scans, seniors often get sent for a brain MRI at the first mention of memory change. It sounds proactive. But for most people over 60, it's the start of a dangerous spiral. Mistakes show white matter changes, atrophy, or spots, terms that sound terrifying but are often normal with age. A 2021 review in Neurology Today analyzed over 3,000 MRs in seniors with mild memory complaints. 86% showed something unusual. But here's the catch. Only 3% were related to actual disease. The rest, age-related changes that needed no treatment. Yet these findings triggered cascades of anxiety, more tests, spinal taps, and sometimes surgery, all for conditions that didn't exist. Consider Robert, a 72-year-old retired teacher from Arizona. After he forgot a neighbor's name, his doctor ordered an MRI just to be sure. It showed minor changes. Robert panicked. He withdrew from social events, convinced he had dementia. His mental health declined, not because of memory loss, but because of fear. 6 months later, cognitive screening showed normal results. The real cause of his forgetfulness: poor sleep and dehydration. He got better without any pills, just lifestyle changes and reassurance. Unless there are alarming neurological signs like seizures or personality shifts, memory issues are often better assessed with simple cognitive tests, not invasive imaging. And yet, thousands of older Americans each year are dragged into a maze of testing, only to end up worse than they started. Checkup No.3, cardiac stress test. It's one of the most common tests given to seniors and one of the most misleading. The cardiac stress test, often prescribed when someone reports fatigue or minor chest discomfort, involves walking on a treadmill or receiving a drug to mimic exercise while heart activity is monitored. It sounds like a smart precaution, but for seniors over 60 without classic heart symptoms, it's often a doorway to unnecessary procedures, complications, and fear. Here's why. The accuracy of stress tests drops sharply with age. In older adults, the likelihood of false positives, where the test suggests a heart problem that doesn't actually exist, can be as high as 40%. That means for every 10 seniors who get an abnormal result, 4 may be perfectly fine. But once that red flag is raised, a chain reaction begins. Angiograms, cardiac catheterizations, sometimes even stents or bypass surgery, and those come with real risks: bleeding, kidney damage from contrast dyes, hospital stays, and long recovery periods. A 2017 study in JAMA Cardiology found that more than half of all stents placed after a stress test were in patients who didn't actually benefit from the procedure. Their survival rates didn't improve, their symptoms didn't change, but their risk of complications skyrocketed. Take Marilyn, 66, a retired librarian from Vermont. She mentioned occasional breathlessness while gardening. Her doctor, just to be safe, ordered a stress test. The result came back abnormal. Within weeks, she was in the hospital. For a catheterization, no major blockage was found, but a stent was placed in a mildly narrowed artery anyway. That night, Marilyn suffered an allergic reaction to the contrast dye and spent 6 days in the ICU with kidney damage. She didn't garden again for almost a year, not because of heart disease, but because of fear and weakness from unnecessary treatment. Here's what most seniors don't hear. If you're not experiencing chest pain during activity, shortness of breath on exertion, or fainting, a cardiac stress test is unlikely to help. In fact, many heart experts now recommend resting EKG or coronary calcium scans instead, tests that are safer, simpler, and far less likely to send you down a path of invasive care you never needed in the first place. Checkup No.2, colonoscopy after 60. This one might surprise you. Colonoscopies are often seen as the gold standard of cancer prevention, responsible, and even life-saving. But after age 60, especially past 70, the benefits of this invasive test begin to shrink while the risks grow fast. What most seniors don't realize is that colonoscopy prep, sedation, and the procedure itself can become dangerous with age, even for healthy individuals. The preparation involves powerful laxatives that can cause dehydration, electrolyte imbalances, and even kidney issues. Seniors with diabetes or heart conditions face additional risks, as fluid shifts can trigger complications. Then there's the sedation, which may linger longer in older adults, increasing the risk of confusion, falls, and even long-term cognitive decline. And that's before we talk about the actual procedure. Colonoscopies can cause internal bleeding, bowel perforation, or cardiac irregularities during sedation. A massive 2019 study in JAMA Internal Medicine tracked over 1.3 million Medicare patients over 70 and found something alarming. For every 1,000 colonoscopies in people over 75, only 2 lives were saved from cancer, but over 20 people experienced serious complications. That's a 10-to-1 risk-to-benefit ratio, one of the worst in preventive medicine. And even when polyps are found, most are benign, slow-growing, and unlikely to turn into cancer in the patient's remaining lifetime. Removing them, however, still carries the full weight of surgical risk. Take Samuel, a 76-year-old veteran. From Texas, he had no symptoms, no family history, and had to clean colonoscopies in the past. But a new primary care doctor urged him to repeat the test just in case. Samuel complied. The procedure uncovered a small polyp, harmless by all standards, but removal led to bleeding, followed by hospitalization and sepsis. He spent 12 days in the hospital and lost 18 pounds. His life didn't improve, he was left weaker, traumatized, and questioning everything. This isn't to say colon cancer screening should be ignored. But after 60s, especially without symptoms or risk factors, safer alternatives exist. One is the FIT test, fecal immunochemical test. a non-invasive stool-based test that can be done at home. No prep, no sedation, and still detects most concerning signs of cancer. Another is the Cologuard test, which combines DNA and blood detection to find abnormalities. Both are widely covered by Medicare and carry near-zero procedural risk. The U.S. Preventive Services Task Force officially recommends stopping routine colonoscopy screenings by age 75 in average-risk adults. And for good reason. After that point, the harms usually outweigh the benefits. Yet, due to outdated habits and defensive medicine, many seniors are still encouraged to go through with it. Remember, prevention should never make you sicker. If you're feeling fine, have a clean screening history. And no new symptoms like bleeding, unexplained weight loss, or major bowel changes, ask your doctor about safer, gentler options. Because what was once life-saving in your 50s may now be life-altering for the wrong reasons. Checkup number 1. Full-body CT scans without symptoms. They sound high-tech, proactive, and even glamorous, offered in executive health packages or advertised in glossy brochures with promises of catching silent killers before they strike. But full-body CT scans for seniors with no symptoms may be the most dangerous checkup of all. Why? Because they expose the entire body to high doses of radiation, often without a clear medical reason, and can trigger a chain of events far worse than the condition they were trying to prevent. One single full-body CT scan delivers between 10 and 20 millisieverts of radiation. That's the equivalent of 500 chest X-rays. And unlike diagnostic scans targeted to specific symptoms, these generalized scans are a fishing expedition, looking for anything that might be wrong, even if it's completely harmless. The result? Nodules, calcifications, cysts, many of which are normal with aging, are flagged as suspicious. Then comes more imaging, then biopsies, and in some cases, invasive surgeries. A 2023 modeling study in JAMA Internal Medicine estimated that up to 5% of all cancers in the U.S. may now be caused by medical radiation exposure, including CT scans. That puts routine full-body scans on par with chronic alcohol consumption as a cancer risk. Think about that. 1 out of every 20 cancer cases could be caused by the scan that was meant to prevent it. Take Irene, an 81-year-old who felt great, hiked weekly, and had no medical complaints. Her adult children gifted her a VIP wellness scan at a boutique clinic. The scan showed a tiny lung nodule 3 millimeters, likely benign. But that harmless spot kicked off a spiral. She was sent for a PET scan, then a needle biopsy. The biopsy collapsed part of her lung, triggering a hospital stay and long-term oxygen therapy. The nodule, it never grew, never caused symptoms, and never needed to be touched. The American College of Radiology, along with multiple medical associations, has now issued formal guidance. Full-body CT scans should not be used for routine screening in asymptomatic adults. They are expensive, high-risk, and have never been shown to reduce mortality in healthy people. If you have symptoms and explained weight loss, coughing up blood, new severe pain-targeted imaging is appropriate. But scanning the entire body without reason is like swinging a sledgehammer at a ghost. You might hit something, but the damage is often worse than the problem. What's safer? Trust your body's signals, stay in regular communication with your primary doctor, and avoid falling for fear-based marketing that sells peace of mind at the cost of real health. We've now uncovered 5 medical checkups that millions of seniors are told they need, but that may, in truth, do more harm than help. Each one is rooted in the same system, a well-meaning but outdated healthcare model that equates more testing with better care, but when you're over 60, more isn't always better. In fact, sometimes it's dangerous. Our modern medical system is built to detect, diagnose, and intervene, but not always to pause, reflect, or ask, will this really help this person live better? Many doctors, under pressure from liability fears or outdated guidelines, order tests as a default. Insurance companies reward volume, not outcome. And most seniors, taught to trust without question, walk into procedures thinking it's the only way to stay healthy. But the science tells a different story. Overtesting can lead to overdiagnosis, and overdiagnosis often leads to overtreatment. And overtreatment, especially in older adults, comes with real measurable risks: infections, falls, medication complications, surgery trauma, prolonged recovery, anxiety, and even death. What's worse, many of these tests detect problems that would never have caused harm if left alone. These incidental findings often look scary, but aren't dangerous. Yet, once they appear on a scan or report, they pull patients into an emotional spiral: the panic, the follow-ups, the procedures, and the financial cost. So what can you do instead? First, understand that prevention isn't about flooding your body with scans and medications. Real prevention starts with lifestyle: daily movement, good sleep, simple nutrition, stress management, social connection. These are the habits that strengthen your immunity, balance your hormones, and reduce the risk of chronic disease far more effectively than most tests ever will. Second, have empowered conversations with your doctor. Ask, if this test finds something, what happens? Next, will this result change how we treat my symptoms? What are the risks of doing nothing? A good doctor won't be offended. In fact, they'll appreciate that you care about your body, not just its numbers. Third, remember that aging is not a disease. Gray hair, slower steps, occasional forgetfulness, these are not reasons for panic. They're part of the natural rhythm of life. What matters more is whether you feel strong, capable, and connected. If a test won't help you achieve that, it might not be worth doing. Take Harold, 73, who used to spend his mornings gardening until back pain sent him into a whirlwind of spinal scans and injections. After months of appointments and new medications, he felt worse than before. Then he paused. He stopped chasing every test, found a physical therapist who focused on core strength and posture, and returned to his tomatoes within weeks. Or Angela, 79, whose daughter pushed her into a memory clinic after she forgot a birthday. The scans were abnormal, the medications made her dizzy, and her confidence crumbled. Until she learned it was all likely age-appropriate change. With brain games, hydration, and walking clubs, she got sharper and more joyful, without a single prescription. These are not rare stories. They're common. You just don't hear them often, because fear sells. But here, on Healthy Seniors, we believe in something different. We believe that knowledge empowers, that your time, your energy, and your body are sacred and should not be wasted on tests that won't make your life better. We believe that wisdom comes not from doing more, but from doing what matters. So before you schedule your next routine checkup, ask yourself, is it really for you or just for the system? Now we'd love to hear from you. Have you or someone you love ever gone through a medical test that felt unnecessary or even harmful? What was the experience like? What helped? You recover? Let us know in the comments below. We read every single one, and your story might just help another senior make a more informed choice. And if this video helped you feel more confident, more informed, or more empowered, please give it a thumbs up and subscribe to the channel. Here on Healthy Seniors, we're building a community that values clarity over confusion and courage over fear, because your best years are still ahead and they deserve to be lived with strength, joy, and peace of mind.